Okay, so for our project, we did developmental coordination disorder with a 7-year-old. So the case study that we used as our base is with Mark, who is a 7-year-old. He was a full-term baby. He was of average birth weight. He was determined to have congenital nystagmus at birth, which nystagmus is just when you have the involuntary eye movement. At age 2, Mark did get corrective eye surgery to try to improve his vision due to the nystagmus, and that was what they assumed his difficulties with those fine motor skills was from. So he did receive OT services too, just to kind of work on the challenges that were presenting themselves at 2 years old. And then he was reevaluated at school at 3 years old, and it was decided that he was to be entered into an early childhood program to address some further concerns about his coloring, his writing skills, and then some concerns with his gross motor performance as well. And he was also receiving outpatient speech and language services because he was still having some difficulties with some speech production and articulation. And then by the age of 7, Mark was referred to an outpatient physical therapy service because of concerns about muscle weakness, atypical posture, poor endurance. He was having trouble with respiratory control, and he also was presenting with uncoordinated movement patterns. And then it was then that Mark was diagnosed with developmental coordination disorder, or DCD for short, which isn't uncommon for it to take that long for a child to be diagnosed with it. It's typically not diagnosed before the age of 5. So Mark was 2 years after that at 7. And it was originally seen that some of his difficulties with motor performance was due to his nystagmus, but then after he had that corrective eye surgery, it became more apparent that it was something else that was causing those difficulties. So after that, he was receiving school-based OT as well as outpatient for some of those fine motor skills, which is like cutting, handwriting. And then he was also receiving physical therapy for some of those more physical activities and the gross motor skills as well. Okay, so just for some general information, what is developmental coordination disorder? What is this diagnosis that Mark has? So it is a lifelong condition, and it has some key characteristics that typically people would look at a child with DCD and just think of them as like a clumsy child, just often, having those uncoordinated movements, either fine or gross, or both. And that result from DCD are really just centered around the fine and visual motor skills. So with reading, writing, things like that, like copying down stuff from books, cutting, coloring. And then there can also be impairments in their participation in physical activities, which can also result in difficulties with social participation because now they're not participating in the activities on like the playground with their peers and stuff at school. And that's due to those difficulties with the gross motor skills and those uncoordinated gross movements. But in order for the child to get the diagnosis of DCD, the difficulties with the gross and fine motor skills has to be determined to not be the result of the other diagnoses or any other condition.
So, being a child with DCD, you do experience a severe impact on your occupational performance. Some specific categories were play and leisure, which is very important for kids around this age. Usually, that is something they are invested in. So, kids with DCD experiencing this disorder could feel as if they're not able to engage in these kinds of things. Also, in education in general, I know Kylie hit on it. Because of their fine and gross motor skills, they do find a lot of difficulty in school. Also, health management, they may feel as if they're not able to be independent. They may require assistance when it comes to managing their health. Also, social participation, which again, Kylie hit on, engaging with peers because they're not able to engage in activities because they may look clumsy or they may not be able to do it. They may feel too fatigued to engage. So that could be an impact, as well as just normal ADLs, everyday things like dressing, bathing, brushing their teeth, all things like that. As for the specific frameworks pertinent to Mark in our case study, we talked about the play exploration and participation as well as the leisure exploration and participation. As I said before, play and leisure are very important to kids around this age. So kiddos with DCD may find trouble finding new activities that they feel interested in because they're not able to carry out the movements. They may feel uncomfortable doing it, or just feel as if they're not as good as the other people that they see doing it. Also, in general, just functional mobility. Like I said, they may experience clumsy movements. Their gross motor skills are delayed, so just getting around the community in general could be quite difficult for them. Also, ADLs that I talked about, dressing, feeding, personal hygiene, bathing, all things that may require assistance that normally kids wouldn't need assistance with. Also, like I said, educational participation and social participation, it may be hard for them to find new friends, which is very important around this time of age. So what we did was look at the expected milestones at this age of 7 to a normal child. These specific areas we focused on was the development of play, which is very important, the occupational performance of cognitive and social skills, fine motor manipulation, developmental progression of scissor skills, as well as just gross motor and mobility.
All right, so possible milestones that you may see in a 7-year-old with DCD. These include they might be struggling with puzzles and building blocks. They might have difficulty holding pencils for either writing or drawing. They might fumble scissors and struggle to cut out shapes, especially more complex shapes. They often bump into people and things, struggling with buttons along with the scissors. And then they would also drop things. We already hit that they would have difficulty in gross motor movements, and some of these movements include jumping, hopping, and skipping. So this is just a continuation of what you may see in a 7-year-old with DCD. So they might not have developed a left or right hand dominance. They might have trouble with self-care routines, whether it's dressing, brushing their teeth, brushing their hair, things of that nature. And then they might have a hard time copying notes from a board in school. So it also affects the education aspect, which Chelsea hit on earlier. And then they would just be moving slowly and awkwardly and trip a lot. They would have difficulty with buttons and zippers, and then they would have trouble forming letters using correct spacing when they write out sentences. So, for the evaluation and diagnoses, there is a few assessments that we have here that we would conduct with Mark that we felt would be best with him. So, the interventions, we have a wide range of types of interventions that we're going to do. And then we have a intervention video. It's a good video that shows the whole big picture of the interprofessional team performing different types of interventions.
A medical doctor can refer a child to the pediatric rehabilitation physician. During this appointment, a careful history is taken and a physical examination. This is important to rule out other possible causes of motor difficulty. Parents are invited for an appointment with the social worker and the psychologist.
Nou, wat voor jongen is Ruben? Nou, Ruben is een hele lieve jongen. Heel zacht, heel sociaal en ontzettend verlegen. Heel zeker.
Questions and needs of parents and the child are a central theme in this conversation, as well as the behavior of the child and school performance. The speech and language therapist can observe the child when there are difficulties in speech, language, and oral motor skills. Ruben also has an appointment with the physiotherapist, occupational therapist, and the psychologist. The physiotherapist observes the child while performing different motor skills. The occupational therapist asks the child and parents if the motor coordination has an impact on these daily activities.
Wordt dit helemaal volgen?
Helemaal, nee hoor. Maar een klein stukje. The psychologist talks with the child about his daily life.
Hey, wat vind je het leukst om te doen op school?
Rekenen.
En wat vind je het vervelendst?
Schrijven.
Het schrijven? Vind je dat ook het moeilijkst?
Ja, en ook het kost me meeste moeite.
Meeste moeite.
Ja.
Vind je dan vooral dat je dat met je handen moet doen? Of wat vind je het lastigste aan?
Ja, schrijven word ik dus dan moe.
Oh ja.
With the parents, a plan is made dependent on the needs of the child and family.
So that was a good video because it really just kind of coincided with our case of Mark, the 7-year-old. Ruben looks like he's pretty close in age to Mark. And he had a lot of the same challenges that our case example Mark has. So he also found writing really difficult. He found that it was just tiring because he would often fatigue while doing writing assignments in class. And then he also had some of those challenges with those gross, uncoordinated motor skills. And that would obviously limit his participation in physical activities. And the mom also said that he's a very shy, insecure boy, which could come from him dealing with DCD and some of the challenges that he faces due to that. And then here we just have some examples of education that an occupational therapist could give to the parent or caregiver of a child with DCD and the teacher of a child with DCD to kind of help support them at home and at school. And these are just our references.